Okay, everyone, this is the third episode of the Aces of the Roundtable podcast. On the panel today are Tofu God and WinterDragon, both from AVEN, and we're here to talk about the Affordable Care Act and healthcare in general. The Affordable Care Act, of course, has been a major topic of discussion now that President Trump has been elected and has a Republican majority in both houses of Congress, and there is a significant push to repeal the Affordable Care Act and replace it with something else. So we're going to talk about that and what the consequences of it might be, what alternatives might be, and about the issue of healthcare in the United States and abroad, really, generally. Alright, so first, I'll say what my bit is that I think that the Affordable Care Act was a step in the right direction compared to the way healthcare in the United States existed before it, which was to say we didn't really have much of a healthcare structure at all. It was just a purely free market type of deal. And there were many good developments in the Affordable Care Act that I think were beneficial. So one example would be keeping kids on their parents' plans until they're 26 to extend coverage. That would be good. Or another good thing was saying that you couldn't deny someone for having a pre-existing condition. That was a very good thing. And it does seem that those aspects of the Affordable Care Act will remain in effect if the Republicans have their way and do a repeal and replace it with something else. So it won't be a complete reversal back to the pre-ACA days. In many ways, I think if you want to tally this, Obama, the Democrats, will have come out ahead if they don't have a full repeal. Now, as far as other things to repeal, the individual mandate, I can see why that's more controversial, but I do think it was perhaps a necessary part of the program to make sure that things are paid for, and to ensure that coverage is expanded. So anyway, that's my opening bit. Why don't we hear from you, Tofu? I know that you're not a big fan of the ACA.
No, not really. There are some aspects of the ACA that I did like, but most of all, it was very cost ineffective. But the aspects of it that I did like was the no denial of pre-existing conditions and not being able to just drop sick people off of the insurance program if they had it. The things I did not like about it was not very cost effective, and the only people who really benefited from it were the insurance companies in the end, because it's very convoluted of why all the stuff that involved, getting the insurance and having to go through all these middlemen and all the subsidies. And I think the biggest problem with the Affordable Care Act is it doesn't work due to different factors than what it intended.
Okay.
And that's all I really got to say.
Okay, well, Winter, before if you want to say anything, please do. If not, I've got something I would ask Tofu next. But let's go ahead and get you in, Winter, if you have something to say on the ACA.
I personally have heard some other stuff about it, some good stuff and bad stuff. I honestly don't have ACA, so I honestly anything against it other than that. What other people have said, it's not a really good company or a medical. Should be really something that other people should sign up for.
Okay. So, Tofu, one thing I wanted to talk to you specifically about is you live in Ohio, correct?
Yes.
All right, so Ohio is famous for having its governor, John Kasich, go against the party norms and expanding Medicaid, which is an optional part of the ACA for states. Mm-hmm. So how do you feel about the Medicaid expansion? I mean, I think that's personally a good thing, since that's one thing that directly benefits poorer Americans who aren't covered.
Yes, Medicaid is one of the things that poor people can benefit from. But I don't really know a lot about it, the qualifications, of how to get it and utilize that to its full extent. So I can't really say anything on that.
Yeah. Well, the gist of it is that, right, Medicaid is public health care for poor people, like Medicare is public health care for old people.
Yeah.
And they just sort of expanded, I guess, the pool of people eligible for Medicaid with the Medicaid expansion under the ACA, as an attempt to make it, have a public aspect of the ACA, and not be completely something that was intended for any part of the healthcare industry, whether it was health insurers or big pharma. But you are right that the ACA was passed in order to please health insurers and big pharma. And I think a lot of that has to do with the fact that it would have been hard to get enough votes in Congress to pass that without their blessing. Indeed, the Republicans could have filibustered the entire reform once Ted Kennedy died and the Democrats lost that 60-seat majority on the Senate. So just to get one Republican happy enough at that point, as well as some of the Blue Dog Democrats, admittedly, there had to be more of that pro-business concession to get it passed. I would agree that that's a bad part of the ACA. And with the premium rates that have increased over the last year, you can kind of see how...
Yeah, the premium rates are atrocious. Same with the high deductibles.
Yeah, but I would say that the thing about the premium rates going up, high deductibles going up, those are things that could happen anyway without the ACA. Because effectively, what we saw with the premium and the deductible increases is that the market was adjusting to something, right? It was adjusting. And it adjusted in a way that it could sort of increase these prices without much consequence. And it can do so without much consequence because health insurers and pharmaceutical companies are nearly monopolistic in their market shares. So there's not big one health insurance company that controls the entire American market, but health insurance companies do have individual states often locked down pretty well. And that allows them to charge things at higher prices. And I guess you could say that maybe a failure of ACA is that it did not have any trust busting accompanied with it, like what Teddy Roosevelt might have done. And that kind of undermined a lot of the ability of the ACA to be as effective as possible. But the thing is, monopolies are an issue unto themselves. And even without the ACA, I think we still would have seen that problem with health insurance companies and the pharmaceutical industry. So I think it's a bit premature to lay all the blame squarely on the ACA like that, just because we already have antitrust laws in place. So we just need to have a government that's willing to enforce them.
Yeah, I blame the patent monopolies and some of the subsidies on the higher expenses and the unionized medicine more than I do the ACA.
Okay, so Winter, do you have any thoughts? I want to give you a chance, of course.
The Medicare and the Medicaid systems are not really that good from what I've been told. People try to get stuff taken care of with them. They have to go into the hospitals for medical treatments, and they don't pay fully as they should, the Medicare, and when they do, they don't pay in time. And so the person themselves get charged for it instead of having the...
Okay, well, perhaps it's not well executed, but a lot of these people would not have any health care whatsoever without something like Medicare or Medicaid.
Exactly.
So it does seem like, while it's not great, it's certainly better than nothing, than just sort of being left to die, in essence, in a completely privatized healthcare system. And I suspect a lot of the grief over the ACA, whether with conservative voters or liberal voters, is that it's a dissatisfaction with a healthcare system that's primarily privatized. I mean, yes, we do have some public health care, but the mainstream is a privatized, employer-based one. And it tends to open up a whole can of worms on other things. So just the fact that birth control is part of healthcare but employers don't want to pay for birth control because they feel like it goes against their religious rights, right? I feel like this shouldn't even be a problem, because why is it employers that pay for your health care? Why can't you just do it more yourself? That's
no middleman.
Yeah, why are they even part of that process? Are they a part of the process in you making your car payment? I mean, come on. That's one thing that's always struck me as odd. So it shouldn't even be a religious freedom issue, I feel, as
It's
much
corporatism.
And I even talked to some businessmen, and they're like, I wish that it wasn't part of the process, because I don't feel like this is really any of my business, and it just complicates the way I compensate my employees. I feel like that's another flaw, again, that existed before the ACA was passed, that no one's seriously talking about. They're talking about, how do we deal with the ACA as a solution to healthcare problems, but there's so many other dimensions to it beyond the ACA and what it did. I mean, I still feel like, though, that the ACA overall would have done better, and it would have gotten cheaper in the long run. We saw, of course, there was market shifts that caused premiums to go up, but by getting more people covered, in the long term, you'd reduce costs, just because if more people are covered, you can prevent diseases and illnesses more, and you prevent more people from getting into a worse state. And it takes a long time to see this, to see the benefits of this, because people will gradually get less and less healthy until finally they get a point where they collapse and they have some sort of emergency event, and some life-saving surgery is expensive, and then the medication people need after they've had a life-threatening medical event is usually much more expensive at that point. Just sort of take, for example, a person who's at risk for diabetes. If they know that, they can make sure they don't get diabetes. But if they don't know that, then they get diabetes, well, now they need insulin, and they need to pay for insulin. That's another cost that exists. Or just to put it generally, if we prevented more people from having health problems, we'd end up having less disabled people. And the thing about disabled people is, well, now you got to pay disability checks for them, and they don't work. They're not putting value into the economy. So I would think that in addition just to lowering the health costs by getting people covered and making sure they're taken care of, you'd also be increasing the size of the working population that's putting value into the economy, and that we're taking on that extra cost of losing that labor that can come with healthy citizens in this country. And I feel like that's something that's not often discussed, because there are some people right now who are saying basically, well, look, if you can't afford healthcare, that's too bad. You don't have a right to healthcare. And I feel like if we are interested in lowering costs and making things cheaper and having a more productive economy, we should treat healthcare as a right, because it would save us so much more for so many different reasons. Any of you have something to say on that?
I don't really mind paying for healthcare, just that it's too expensive. Like, the ACA would cost me like my entire paycheck just to pay for it. And I think that's one of the biggest things people did not like. And then being fined at the end of the year as well for not buying insurance because you couldn't afford it.
Right. So it seems to me that there's this awkward group where they're not poor enough to benefit from the Medicaid expansion, but they're also not wealthy enough to get
They're around the poverty line.
Right. They're not wealthy enough to get a good healthcare plan on their own. So they're being hit with these high costs in a way that's just cutting right into their paycheck. That's obviously bad for them, because what good is healthcare if it completely destroys their household budget and then they can't pay for things? Healthcare is what you need in case something happens, but in the meantime, stuff's happening. You got to pay for your electric bill, you got to pay for your food, for your clothes, and all those other necessities. So yeah, I understand that. That's why I think probably even more of a Medicaid expansion would probably be good, because generally speaking in the United States, the bar that we set for considering someone poor or impoverished is too low. There's a lot more people that I think could be considered impoverished that we don't consider impoverished. So I guess one thing that stands out to me, though, is just even under the ACA, we do not have every single person covered. There are people who are not covered. Now, in the interest of covering everyone, like I've said, and why it would be beneficial, some people think that the necessary fix to the ACA is just to have a public single-payer system. All right, what do you two think of that? Just either one of you.
I'm not sure.
Yeah, I'm same with that too. It's kind of complicated.
I felt the ACA was trying to force people to be on Medicaid rather than having insurance in general.
I can't really afford insurance myself since I'm unemployed until I can get the job.
I felt it drained the middle class.
Okay, so but what do you think of moving toward a single-payer public healthcare system as a solution to the ACA, in which basically everyone's covered? I mean, you're covered just by being a person in the United States, and it's essentially paid for through taxation.
I think I would prefer single payer.
Okay, so you would prefer single payer over a private employer-based system.
Yes.
Okay. Now I've seen that. Now this is just interesting because you're in favor of an ACA repeal.
Yes.
Maybe not a complete repeal, but gutting the.
I'm not in favor of a complete repeal.
Right. You're in favor of gutting the individual mandate.
Yeah.
All right. So in that sense, you're in favor of a more market-based healthcare provision system. But
which is one of the reasons I supported Trump's, dissolving state borders for insurance, so you can buy in other states.
Okay, and so in one sense, you're more open to a more free market-based type of healthcare system. But on the other hand, you also think a public socialized healthcare system would be better than the ACA.
Yeah.
That is interesting. But between a more free market solution to the ACA and between a more single payer public solution, you prefer single payer public or free market?
Can you explain the exact differences between them?
Well, essentially, it's just by repealing the ACA, it would be much more market based. The government would not be setting as many rules on healthcare, and providers would have a lot more liberty to do a lot more of what they did back in the pre-ACA era.
I prefer to be less middlemen, less bureaucracy involved around it, so less regulations, and you can just buy, what you want.
Okay, so with a single-payer system, though, there would be really no free market for healthcare. Essentially, every health insurance company would disappear; they'd be gone, and there'd just be one federal system for paying for everyone's healthcare, and there wouldn't be choices per se. I don't think. I mean, I guess if the federal government wanted to, they could have different levels of plans or whatever, I guess, but in essence, there'd be one plan and you'd just be covered. You might not even have to apply for a plan. It's just you might go to a hospital and the national Medicare system would pay for it. That's
you mean like the NHS or whatever?
Yeah, much like the NHS. So you wouldn't have to look for a plan. You just be covered. You get sick, you go, and you're covered.
I would prefer that, but my concern is with costs and being able to maintain.
Right, so it would be
as big a population as you.
It would be costly, in the short term, just because we'd have to raise taxes on it. So it would be pretty costly in the short term. But like I said, in the long term, it would really give us a lot of savings because people, of course, would be healthier longer. They could work longer, and they wouldn't. And their health bills would be cheaper just because they'd be prevented from getting into those more disastrous medical states that require more expensive procedures and medication to save people's lives. So in the long term, it would be better. But it takes 10 to 20 years to see the benefits of that. And I think part of the reason why the ACA feels very expensive right now is because it hasn't been a very long time. I mean, it feels like it got passed a long time ago, but we're like 6 years into the ACA. Not even a full decade, and it takes a decade to 2 decades or even 3 decades to see the difference in long-term health benefits with a system like that. Just because we live that long, our health will decline at gradual rates, and that's more or less how it works. So not enough of us have lived long enough and sustained our health long enough for us to have seen the benefits of it like that. And it would be a while before we saw it with like a Medicare for all system. However, there would be other things that keep the costs down in the short term, I think. So if Medicare could negotiate with the pharmaceutical industry, for example, keep them from jacking up the prices of medication, that's one thing that would lower costs a lot. Another thing that would lower costs is there'd be a lot less administrative costs, for example. Just a big one. So United Health is the biggest health insurer in the country. Their CEOs tend to make, when you add salaries and stock options, about $100 million a year. Okay? Now, consider how much the President of the United States makes as their salary, their compensation for being president, regardless of who the president is. It's $400,000 a year. And that's to be the president of the whole country and of every part of the country, right? Everything, not just healthcare, but the military, the national parks, education system, foreign affairs. They're covering all that stuff, and they get paid only $400,000 a year, versus a guy or girl, I guess, who is CEO of one health insurance company who gives health insurance to some of the country, and all they're doing is giving health insurance, and they get $100 million a year just to do that, and they're just the CEO. All right, then there are other executives in the country. Other people on the board. There are investors who get some of a chunk of your premiums and deductibles in their stock dividends. Okay, that's a big part of where the money goes in a private system. And then, of course, a lot of advertising costs, because if you have to compete, you need to advertise. And we also know that there's a lot of insurance commercials on TV. That's like half the commercials, it feels, doesn't it?
And those are really, really expensive too.
Yes, TV ads are very expensive these days. It's a big reason why so much money is dumped into political campaigns for TV advertisement, and why politicians rely on big donors so much, because to put an ad on TV in a good slot costs a lot of money. 30 seconds will be more than you make in a life to pay for that ad. So that's one thing. If you had a national Medicare system, you wouldn't advertise, because why would you need to advertise? You're not competing with other. You're the only one. That would be a big cost that goes away. Another thing that would go away is the fact that we're doing all this for like you said, it's a middleman who doesn't really add anything. So the automobile.
Except the cost.
Yes. So the automobile industry, for example, their product, automobiles, they make those more efficient over time. And that's sort of the logic of the free market, letting them do things, right? Free market will make things more efficient over time through competition and innovation. So automobiles are always getting better, right? If you take an automobile today and compare it to an automobile 10 years ago, same model, same manufacturer, you can see the difference in the technology.
Sometimes they're worse.
Yes, sometimes they're worse, but usually they're a lot better. They have a lot more built into them. Their radio consoles are better. They're usually more fuel efficient. They're usually more aerodynamic. There's more safety features that they've implemented.
Safety features are one of the biggest things for cars.
Yeah, so those are things that improve over time. But health insurance, how do you really improve that product? Because basically it's just people pooling money together, and then you issue out sums of that to people who need to make a payment whenever they need to make a payment. But other than that, you're not really doing anything. You're just piling money and just handing bits of it out as needed. And that's all it will ever be. And
I never understood why people couldn't do that themselves, though. Why do they need an insurance to begin with? other than, life-threatening diseases, that you don't predict, that you randomly get, and then you got insurance to cover that. But what about young people? They don't need that stuff.
Well, sometimes young people need that stuff. Even young people can get sick or injured. And in those moments, it's good to have your payments covered.
That's what catastrophic insurance is.
Yeah. But also, part of the way the economy works in general is the younger working population sustains the older non-working population. And that's going to be a harder balancing act to perform as our birth rates go down in the West. So this isn't just exclusive to America. And there's less of a young working population. And it's also going to be complicated by the fact that within that shrinking younger population, more jobs are being replaced by automation and robotics, performing those tasks that used to be performed by humans. So there's that as well. And a lot of people have said that's why we can't have a public healthcare system. But the thing is, we would still have that problem even with a private healthcare system. It wouldn't go away. It's just, it would be a private healthcare system. And the private healthcare system would be adding even more costs with the middleman and advertising and administrative waste. So I think a public healthcare system is the best way to go. Winter, would you I haven't heard any thoughts from you in a while. Would you agree with that sentiment?
Yes.
Okay. All right, so we're coming up on about half an hour now. Are there any last statements you want to make that you think are relevant to the ACA and its imminent repeal and what the United States can do moving forward to improve healthcare? Let's hear from you first, Tofu.
I think they should get rid of all the bureaucracy, the middlemen. You pay the state directly for it instead of, having to pay insurance. You just pay the tax for ACA, for medical in general, and then you get free medical from the state.
Okay. And you, Winter?
We're not free. You pay the tax.
Okay.
I think what should be done is that the taxes should go towards it, and we just pay. We could get the medical treatment free that we need. The states do need to get the system to be better, so people can get better health care compared to what many get now.
Okay.
I'm not against co-pays either, to cover a little bit of the cost, on top of the tax.
Okay. Well, all right then. We're at about half an hour now, so I'm going to bring this to a close. Thank you both for joining me, taking the time to sit down and discuss this, and helping me experiment with a less structured approach to the podcast.
My horrible stutter.
That's fine. Anyway, that's our third episode, so we'll join you next time as we record our fourth episode of this, hopefully, ongoing series, Aces of the Round Table. Thank you.